Hello everyone, welcome to my channel Lakshmi Money. As we discussed in the introduction video of this channel that I'm going to teach both for NEET and MBBS first year and second year as well. So today we are going to start with the MBBS second year syllabus. It's nothing but pharmacology. Pharmacology. Let's discuss about pharmacology. Today is just going to be the introduction of pharmacology. We have two categories of pharmacology. It is general and systemic. So to understand the systemic part of pharmacology, you have to be very thorough with the general part, because general pharmacology is the core of understanding the systemic pharmacology. So general pharmacology is to be understood very carefully, and we'll be discussing the general pharmacology now on. What's pharmacology? Pharmacology. What is it? Pharmacology. What is ology? Ology is nothing but study. What's pharma? Pharma is nothing but drugs. So it's nothing but the study of drugs, or science. Science which deals with drugs. So pharmacology is nothing but the study of drugs, or the science which deals with the drugs. Okay, to understand this pharmacology, we have divided this into many branches. It's very complex to understand a complete subject. As it is a very big part, we have to divide it into chunks so that it can be sorted. So pharmacology is mainly divided into two divisions. What are those? Pharmacodynamics and pharmacokinetics. So pharmacodynamics and pharmacokinetics. So what's pharmacodynamics? What's pharmacodynamics? It is something the drug does to the body. So we are taking some drug, it has to do something to the body. That's when there is a use of the drug. Simply we don't take a drug for some fashion or aesthetic purposes. We take a drug when we have a fever or cold or pain or some disease. It has to be cured, right? That's the reason we take drugs. So when we take a drug, it has to do something to the body so that the illness is cured. That's what called pharmacodynamics. And what's pharmacokinetics? It's something the body does to the drug. So we are taking a tablet. Let's assume we are having some hand pain or leg pain or stomach pain. Let's assume we have a stomach pain. Girls have a stomach pain. They are having some period pain or some pain. We'll take diclofenac or we'll take ibuprofen. Okay, let's make it simple. We took diclofenac. We took it in a tablet form. Is this going to act on each and every cell? Is this one tablet going to every cell and acting? No, right? So this tablet, it has to be dissolved in the juices. It has to be absorbed into the bloodstream. It has to be transported. It has to be transported. Where it should be transported? where the certain pain is. If it is selective, it will go only to that. If it is not selective, it is going to all the receptors of the body. Okay, we'll discuss it further. Okay, it is transported to the site of illness. Okay, it should be transported further. It should be binding to the cells. It should be binding to the receptors. Okay, the receptors it have to bind, and then it have to show some action. Is it? So this whole process is what body is doing to the drug is only acting on the body, but body have to break down the drug. It has to be absorbed, it has to be transported, it has to be stored if possible, and it have to metabolize the drug after its action is over. Okay, action is over, then what is going to happen? The drug has to be excreted, right? For excretion, it has to be metabolized. Metabolized, then it has to be excreted. This is what is going to happen in our body. So whatever the body is doing to the drug, it is called as a pharmacokinetics. Clear? And not only these two divisions, we have some other divisions also. What are those? Pharmacotherapeutics. Pharmacotherapeutics. Okay. What is therapy? Therapy is a process of curing, right? We are curing some disease, so that's called therapy. Okay, what's pharmaco? It's using drugs, right? Drugs. So we are using drugs to cure some disease. That's what's called pharmacotherapeutics. So pharmacology, the knowledge of pharmacology is used for curing some disease, right? Or it can be prevention also. Okay, and the other division. Okay, what is clinical pharmacology? What is clinical pharmacology? Clinical pharmacology is nothing but, okay, we'll take an example and talk about it. Recently we had a pandemic of COVID-19, right? Okay, we are given vaccines. How do you think these vaccines came into existence? Do you think they just prepared them in the laboratory and they directly gave it to us? No, right? So they'll be investigating the drug. How is it acting? Is it reducing all the symptoms or not? Is it uh, efficient in preventing the disease or not? Is it efficient in curing the disease or not? How will they investigate? So they'll be having trials, right? There will be trials. They will be performing trials on the laboratory animals. They will be performing trials on healthy volunteers, right? Okay, this is something about clinical pharmacology. Then, what is chemotherapy? Chemotherapy. Therapy. What is it? It is curing. What is chemo? Chemo is nothing but chemical. So we are using some chemicals to cure some disease. This branch is related to the chemicals which cure the disease, right? So generally we use chemotherapy in malignancies, cancers, and some systemic infections. So we are using chemicals. They have to be tested for their toxicity levels. There should be minimal side effects, or there should be no side effects if required. This is what chemotherapy is going to deal with. Then, what is pharmacy? Pharmacy. Pharmacy is where we get drugs. Where we can get the drugs. Simply, pharmacy means where we can get the drugs. What is pharmaceutics? We'll be seeing in many movies pharmaceutical companies, etc., etc., blah blah blah. What is pharmaceutics? Pharmaceutics is where there is a large scale production of drugs. Large scale production of drugs. That's what called pharmaceutics. And toxicology. Toxicology. So we are taking some external things, external chemicals, which are natural, which may be natural or synthetic or semi-synthetic. We are taking the drugs. So they can be toxic also, right? They have some poisonous effects which should be minimized because they are going to be intaken by us. So the study which is dealing with this poisonous effects of drugs is toxicology. Next, what's pharmacoepidemiology? Pharmacoepidemiology. What is it? What is epidemiology? Epidemiology is nothing but distribution of some disease in the given population. So in a set of individuals, in a group of population, let's say there is a street called Gandhinagar or Gandhi Street, whatever. Some people are residing in that street. So there is a prevalence of malaria in that area. So area-wise distribution of the diseases is called as the epidemiology. It's the study of the distribution of disease in a given population. So what's pharmacoepidemiology? It's the interaction between the drugs and the population, right? Okay. What is chronotherapeutics? What is chrono? Chrono is nothing but time. Okay. Let's take an example. We'll take paracetamol. There are some drugs which are to be taken after eating the food. Some drugs are to be taken before eating the food. Some drugs are to be taken at the bedtime. If anyone know, example of the drug which we take without eating the food, early morning, anyone? The gastric tablets, as you all know, our mothers, they use them very frequently. The gastric tablets they call. So these are the various branches of pharmacology. What are those? Pharmacodynamics, pharmacokinetics, pharmacotherapeutics, clinical pharmacology, chemotherapy, pharmacy, pharmaceutics, toxicology, pharmacoepidemiology, and chronotherapeutics. Oh, okay. We discussed so much about pharmacology. But what's pharmacology? It's the study of drugs. Now, what is this drug? Drug? What is it? Drug is nothing but it is a chemical substance. It is a chemical substance. It can be from natural source or synthetic source or semi synthetic source. It can be natural, synthetic, or semi synthetic. What is it used for? It is used for the treatment or prevention or diagnosis of disease in an individual, right? Okay, this is what called a drug. And is it beneficial or is it very harmful? Now, in recent times, the word drug is used for the drugs which are abused, which are addictive. But the word drug means which is beneficial for the mankind in curing the diseases, in preventing the diseases. But now frequently it is used as an addictive or abused substance, right? The word medicine is more relevant to the drug what we are talking about, right? Okay, so drug has many sources. What are them? Natural sources, synthetic sources, and semi-synthetic sources. What are the natural sources? What are the natural sources? Plants, animals, minerals, microbes, and of course, we also come under animals. But let's mention it separately. Humans. Okay. What are the drugs which you know which are derived from plants? As we already studied in our 12th and 11th for our need, morphine, where is it derived from? It is derived from a opium plant. Atropine, atropine is from Atropa belladonna. These are commonly abused. And the oils, the essential oils which are used in pain relief, lotions, or pain relief oils, what are those? Eucalyptus oils. You heard about that? Eucalyptus oil. And when you have a tooth pain, clove oil, peppermint oil, these are used for pains. Is it? Yes. And essential oils are also used for fragrance, right? Many perfumes and everything. Okay. Then animals. What are the drugs we get from animals? As we all studied in biochemistry in the first year, the liver, animal liver is rich in vitamin B12. It is used as a supplement, right? It is a drug, liver extract. What about insulin? Insulin is derived from animals, right? Earlier, but not now. It is made from recombinant DNA technology. So earlier, insulin and the hormones like adrenaline, thyroxine, these are derived from animals. Then minerals. What are the minerals? Like lithium carbonate, magnesium hydroxide, aluminium hydroxide. These are the minerals which are used as drugs now. And lithium metal is also used as a drug. You'll be knowing it. What are the microbes? What do we get from these microbes? What drugs do we get from these microbes? Actinomycin D. This is very frequently heard name in our 12th, right? Actinomycin D. It is used as a anti-cancer drug. And from humans, what do we get from ourselves? What are the drugs do we get? What is HCG? Human chorionic gonadotropin. Human chorionic gonadotropin is also used as a drug which is derived from the humans. These are all the natural sources. Okay, let's come to the semi-synthetic ones. What are the semi-synthetic ones? Semi-synthetic ones are modified natural drugs. These are the modified natural drugs, right? And synthetic drugs are completely made in the laboratories or pharmaceutics. They are not from the natural sources. Okay. Refer to the examples given in your textbooks. We learn what is pharmacology. We learn what is a drug. So this is the introduction to the pharmacology. We'll be learning about the general pharmacology in the further videos. We'll be starting with the roots of drug administration and drug nomenclature. Next video will be about drug nomenclature and the rational drug use, the roots of administration of the drugs. This is about today's video, and any doubts or any queries, you can comment me in the comment section below, and the NEET aspirants as well. You can comment which subject to be started first, so that we'll be starting as soon as possible, right? The next lecture in pharmacology will be the general pharmacology. We'll be dealing with general pharmacology. Subscribe the channel below so that you can reach out to our channel and watch the lectures on MBBS and NEET as well. This is about today's video, and see you in the next video. Bye.